Hi, it's Dr. McCarthy again, and this is Thyroid Treatment Success Secret video number 4. Again, we're going to talk a little bit more about your immune system and autoimmune conditions. In the last video, we spoke about the thyroid antibodies. This is a real simple blood test that needs to be run. If you haven't had it done, you need to call my office immediately and set up some time. We can give you a requisition to get the test done. It's a cheap test, covered by most insurance carriers, and even if it's not covered by your insurance carrier, it just costs a couple of dollars. But this test alone can give you an enormous amount of information as to what's going on in your life, why you're still having thyroid symptoms, even if you're going to your endocrinologist and you're taking your medication, why do you still feel miserable? Simple test. If you haven't had it done, you're just guessing. I don't guess with my patient's health. Secondly, another surefire way to find out if you are autoimmune is you have other autoimmune conditions going on at the same time. People will say, well, I don't know if I have Hashimoto's, autoimmune thyroid problems, but I've got lupus and I was diagnosed with scleroderma and my mother has this one and that one. There's a strong likelihood that that's your problem. If you've got other autoimmune conditions, like I mentioned in one of the other videos, most people who have one autoimmune condition have multiple autoimmune conditions. It's not let's treat Hashimoto's, let's treat lupus, let's treat scleroderma. It's let's balance your immune system. Fix your immune system and it stops the attack on all of the target tissues. In this case, we're talking about thyroid. If your symptoms wax and wane, lots of people will say that. Oh, I get flared up. When you get flare-ups and then they quiet down, and then you get a flare-up and they quiet down, that is highly characteristic of an autoimmune condition. So again, it's not diagnostic, but if this is your problem and you've got another autoimmune condition and you test positive for TPO or TGB antibodies, well, then we know what's going on. Another way I can tell is when we get a new patient here in our office is we request their prior medical records. And when someone comes in with medical records that are an inch thick, they've been to 12 different doctors, 16 different doctors, been to the experts, all the famous clinics, they've flown all over the country. Well, I'm pretty much guaranteeing you that there is an autoimmune problem going on. If you've been everywhere and tried everything and you can't get results, it's because nobody's looking at your immune system like we do. Next thing, I'll tell people, bring in your supplements. Let's see what you're taking. If someone has to bring a shopping bag to show me all their supplements, yeah, that's a bad situation. And most of the time we find that some of these supplements are actually contributing to their problem. It is a terrible situation. So we sit down individually and go through all of your supplements and tell you this one's okay, this one's okay, this one's no good, don't take it anymore. We'll go over that with you. And this is very characteristic of people who have autoimmune conditions. My life fell apart after I got sick. Or my life fell apart after my pregnancy, very commonly in the third trimester of pregnancy. When you get sick, or even in the third trimester of pregnancy, you can get a big time tip in that immune system. Remember we talked about the balance. If you get tipped in one direction and you are stuck and you cannot balance the immune system, you're going to wind up with an autoimmune condition that's going to run the rest of your life. My job is to diagnose this thing, find out where the problem lies in your immune system, get your immune system balanced, and give you back your life. I look forward to seeing you in my office. Call now for more information. Thanks.